Greetings, faculty and students. My name is Jessica Dunnigan, and today, along with Remigio Acevedo and Allison Rogan, we will review how the adoption of patient portals can positively impact practice management, including shared decision-making and treatment adherence. This presentation will specifically explore the positive impact of patient portal use in primary care, increasing patient engagement and satisfaction. Please note that we have no financial or conflict of interest related to this presentation. All content is for educational purposes, and the information presented is based on peer-reviewed research. Additionally, all images used are in accordance with a royalty-free license. Advances in technology have shaped the modern delivery of healthcare. One significant innovation is the development of patient health portals, which allows patients real-time access to their healthcare information and provides a means for patient-to-provider communication. The current literature strongly supports its use as it positively impacts patients, providers, and health practices. Patient health portals, or PHPs, are patient-facing interfaces of electronic health records that enable patients to access medical records, including test results, medication, and treatment instructions. Here, patients can often interact with healthcare providers requesting prescription refills, appointment scheduling, and patient-provider interaction. Portal use can be as effective as non-digital interventions, especially in chronic disease management, without harming the current doctor-to-patient relationship. Yet barriers such as digital literacy and understanding of the portal platform present challenges in its utilization. About 90% of healthcare systems in the country offer patient portal access, yet only 15 to 30% of patients utilize it. We conducted peer-reviewed research with literature published in the last 5 years. Findings consistently show that the adoption of PHPs has emerged as an essential and valuable tool to improve the quality and efficiency of healthcare services. However, most recently, barriers such as digital literacy, interface issues, privacy and security, and social determinants of health pose challenges in its utilization.
Evidence suggests that lower digital literacy is linked to reduced use of patient portals. Patients who struggle with digital tools often have the greatest health needs, such as low-income individuals and older adults, making them key targets for patient health portal outreach. Supporting portal enrollment in these groups could improve outcomes and reduce costs for both patients and providers. Literature supports in-person enrollment and training and involving trusted caregivers to overcome digital literacy barriers. In practice settings, ancillary staff could screen patients for portal enrollment during check-in or check-out. Those not enrolled could receive brief training or be assessed for caregiver support. Connecting patients to community resources like libraries and nonprofits aimed at promoting digital inclusion is also an evidence-supported intervention. Another challenge to portal adoption is related to the usability and interfaces of these portals. Patients often struggle with portals due to poor functionality and non-intuitive interfaces, such as fixed font settings and complex menus that make information hard to find. Patients cite that it is incredibly cumbersome to navigate these systems, and these challenges often dampen their enthusiasm to use portals. Though most portal software is vendor designed, practice managers should explore customization options to better suit their patient population, especially by incorporating audiovisual resources which are well supported in literature to improve usability. Regular patient feedback via in-person conversations or portal surveys is also essential to guide necessary system improvements. Privacy and security concerns can also serve as another barrier to portal adoption. The risk of a data breach, hacking of accounts, or compromise of personal information can often be a significant concern of patients when accessing patient health portals. Data breaches are a valid concern for patients when using portals. While protecting digital data is complex, providers and staff can take proactive steps to enhance privacy. Regular cybersecurity training is essential, including guidance on password security and recognizing suspicious messages. Patients should also receive basic cybersecurity education as part of portal onboarding. When considering the impact of patient health portals on care and outcomes, it is critical to consider the role of social determinants of health in portal uptake. Research strongly supports that patients with lower income and education or those in rural areas often lack internet access, making them less likely to use patient health portals. These are often the patients who need the additional support the most, thus contributing to healthcare inequity even further. Addressing social determinants of health as they relate to portal utilization is very nuanced. However, practice managers can help address disparities by analyzing their population's demographics and working with vendors to tailor systems, such as adding language support and aligning content to patients' educational levels. Practice managers should also consider their role in advocacy for internet access equity.
That said, practice managers are key in the implementation and the adoption of patient health portals to ensure clinical workflow and facilitate patient-provider communication. A recent systematic review found that portal use not only increased the recommended use by 77%, but it also improved disease knowledge by 70% and increased patient involvement by 56%. Although many strategies are key in helping practice managers implement patient portal use, We strongly believe that data-driven results are key to encouraging its adoption. Understanding these metrics can help address barriers and additionally provide data-driven solutions, underscoring that portals reinforce care and do not replace the patient-provider relationship. Equally important is that patient engagement is key to prevention and chronic disease management. For example, a recent randomized control trial found that EHR-based patient portal use led patients to reestablish care with providers after missed appointments 22% of the time, compared to 11.6% of the non-EHR control group. Moreover, these portals, especially after the COVID-19 pandemic, were found to be vital in patient-provider communication. Systematic reviews have consistently shown that patient-centered digital records enable patients to have a more active role in care when having access to their medical records, including medication lists and laboratory and imaging results. An example of benefits of patient health portals is a cohort study of HIV patients in Tennessee. Findings sought that patient portal use was significantly associated with better clinic retention and viral load suppression, which are key factors in reducing HIV transmission and mortality. These findings highlight the role these portals have in improving individual and public health outcomes. A large systematic review of 81 studies highlights the significant benefits of patient health portal integration, including improved patient disease knowledge, better self-management, and enhanced use of provider recommendations and reduced ER visits and hospitalizations. The implications of this can be far-reaching and can impact the larger scale of the health delivery greatly. Health portals have the potential to significantly impact patient outcomes and clinic efficiency by improving patient-provider communication and empowering patients to be active participants in their care. While there can be many barriers to their adoption, many evidence-based solutions exist to help practice managers best support their patients in realizing the full potential of portal integration.